Welcome back, everyone. Let's get to the latest on the pandemic. The FDA has published briefing documents on Johnson & Johnson's coronavirus vaccine ahead of a new advisory panel meeting on Friday. The report showed no specific safety concerns that would prevent the panel from issuing emergency use authorization. 3 trial participants had severe adverse effects after receiving the single-dose vaccine. Research released earlier this month found no COVID-19 related deaths among participants who got the dose. The vaccine's level of protection varied by region, demonstrating 66% effectiveness overall, 72% here in the U.S. In South Africa, efficacy against severe or critical cases of COVID-19 occurring at least 14 days after vaccination was 73% and increased to 81.7 at least 28 days after vaccination. Emergency approval is expected as soon as this weekend. And this news comes after executives from several major coronavirus vaccine makers laid out their plans for boosting vaccine deliveries. They expect to send out enough doses for most Americans to be vaccinated by the summer, but when more vaccines are expected to be on the market is still to be decided. As of now, more than 13% of people living here in the U.S. have gotten at least 1 dose. AstraZeneca expects U.S. regulators to approve this vaccine in early April. It will provide 50 million doses by the end of that month. And on the state level, the White House says it is increasing shipments this week. States can expect 14.5 million doses. And the FDA also expected to make it easier to store Pfizer and BioNTech's vaccine. Regulators reportedly will greenlight the company's request to keep their doses in standard freezer temps, which will likely help distribution efforts. And here to discuss Johnson & Johnson's coronavirus vaccine further is Dr. Asha Shah, Associate Director of Infectious Diseases. Doctor, thank you so much for joining us. So Johnson & Johnson's COVID-19 vaccine meets requirements for emergency use authorization, something we were just talking about up top. What does this mean for our fight against the coronavirus?
I think it means just an expanded access to vaccine and supply. Our issue kind of all along for the past 2 months or so has been a lack of enough vaccine to get enough Americans vaccinated. So this news is actually really promising because we expect it to expand our supply and we'll be able to get more shots in people's arms in a more efficient way.
And we just spoke a little bit about efficacy rates in the trials. How does Johnson & Johnson's vaccine compare to the ones that we've seen already on the market with Pfizer and Moderna?
Yeah, so the Johnson & Johnson vaccine's efficacy really depends, it was different depending on the geographic region where it was studied. In the US data, it's a 72% effective against moderate COVID, but 85% effective at preventing severe COVID or hospitalization from COVID. And that's a very good number. The Johnson & Johnson vaccine trial took place at a different time period than the Pfizer and the Moderna vaccines. We are now in a period of time where we're seeing more spread of variants. And so it's not necessarily comparing apples to apples when you're comparing both trials. If you could argue that if you looked at the mRNA and vaccine efficacy in the setting of more variant spread, the efficacy may actually be quite similar.
I'm so glad that you mentioned that because I think there is a little bit of confusion when it comes to the efficacy rates. So you mentioned things like time period and variance being really big factors in this. Do you think that people should still be very optimistic about this Johnson & Johnson vaccine despite that rate being a little bit lower than what we've seen previously?
Absolutely. I don't want the message to be that this is not as good as the mRNA vaccine. We're really behind this one. We still have to see kind of the fine print of the data, and we're hopeful that the EUA will come out at the end of this week. But this vaccine, the preliminary data shows that it's safe and it's efficacious enough to try to help us get through this pandemic.
We also noted Pfizer and Moderna pledging a massive vaccine surge to boost the U.S. supply. What does this mean for the rollout and making sure that we're getting enough of the vaccines out to the public?
I think it means, again, more vaccines, more individuals getting immunized and stamping out COVID. I think that this will help in all of the state plans to try to get folks vaccinated before this summer.
Do you think we will actually see more Americans vaccinated by the summer?
I'm hopeful that we will get there, especially with this news from Johnson and Johnson and this promise to get more mRNA vaccines out as well. And the fact that the Johnson and Johnson vaccine doesn't have the stringent storage requirements as some of the mRNA vaccines, I think it'll also make it more accessible for our underserved populations and minority groups that need to, really pick up on their vaccination.
Doctor, wondering if you have a message for people who are getting access to the vaccine, getting vaccinated. What do they need to know about after they receive their shot? Do they still need to be cautious?
Yeah, so the public health measures and recommendations remain the same at this point in time, regardless of your vaccine status. So, like many of us in healthcare who have been vaccinated, it's still very important to wear a mask appropriately that's well fitting, to practice social distancing and hand hygiene. We have to continue to do this until we get enough individuals in this country vaccinated, and also until we get more concrete scientific evidence about the vaccine's ability to prevent asymptomatic spread of COVID.
We're also hearing here in California, I just saw a headline yesterday talking about the potential threat that variants pose, and I'm not sure if it was fear mongering or something that was overly cautious. Do you have any update on that side of things and just how dangerous variants could pose a threat to a lot of the regions where we're seeing them?
So at this point in time, the variants, the UK variant, the South African variant, are not thought to be more dangerous. I think what's the most concerning about these variants is their ability to be transmitted from one person to the other. They're up to 70% more transmissible. And then, of course, there's implications on immune recognition by vaccines and therapeutics, but there's no evidence to suggest that they cause more mortality, more death, that they're more dangerous. But it's a situation that we see another surge because of the variants. But it's also possible that our vaccine supply and rollout will beat that, and we'll be able to vaccinate enough people before that could happen.
And in terms of what we're seeing recently with a lot of these updates coming out on the vaccine front and distribution, how do you feel about the timeline of a return to quote normalcy? I think everyone is so anxious to get back into the office, or a lot of business owners looking to have customers back in person. We're hearing about movie theaters reopening in New York City at a 25% capacity as soon as March. So everyone really eager to return to that new normal we're talking about. What do you think it looks like for us? Will it be summer or fall, or can we expect it to be kind of in flux for the next year or so?
I'm cautiously optimistic. I do think that things will be better, by perhaps late summer, early fall in this country, as long as vaccine rollout continues to improve. But coronavirus is not going to go away. It's likely going to be a disease that becomes endemic, and that we're going to see, from time to time, and may need to continue to get vaccinated for. So I don't think COVID's ever going to go away completely. But I do hope that we'll get back to some semblance of normalcy towards the end of 2021.
Lots of really good information there. Really appreciate your perspective. Dr. Asha Shah, Associate Director of Infectious Diseases at Stamford Health.